Hey folks, Dr. Paul Tortland here. This brief video is introducing you to a new intraoperative drill from the fine folks at CERVOS Medical. They're the ones who make the Marrow Solutions bone marrow aspiration kit, as well as the new Key PRP kit. If you're like me, you've been having trouble getting your cannulas from the Arrow on Control or the Teleflex people. They've been on back order, and it's been a nightmare trying to get the sizes that we need. So I got this new drill and cannula system from CERVOS, and this video is just a brief introduction to the drill and the cannula system. I have to say it's pretty slick, and I particularly like the cannula system with the way that the cannula and the stylet interlock with each other. It makes it really easy to chuck in the drill and really easy to use when in the patient. This system can be used both for intraosseous injections of PRP or bone marrow, but also to harvest bone marrow. So here's the video. Hope you like it. Message me with any questions. So this is the new drill from CERVOS Medical, and this drill is to be used both for intraosseous injections as well as for driving the Marrow Solutions device for bone marrow harvesting. This drill is battery powered. There's a rechargeable battery in here. Other than the battery, the entire unit is autoclavable. What's nice about this is there is both a forward and a reverse, and you've got a chuck to chuck in the bits. Now for intraosseous injections, we have cannulas of different gauges and different lengths. And what's nice about these cannulas is you see that there is a collar, and that collar will spin either to the left or to the right when the drill is going in forward and reverse. It happens automatically. And that collar will lock the device so that the sheathed cannula cannot slide off of the stylet. To remove the stylet, you would then center that little tongue in the center of the collar, and once it's properly centered, the pieces will then come apart. And you see that there is a lure lock attachment on the cannula that you can attach a syringe to, either for aspiration or for injection. Put it back together, you lock it in. This will chuck into the drill. Let's open that up a little bit to give us a little more. And then using the chuck key, you can tighten this down. And now, using the forward or reverse, you can spin. Once this is in position in the body, you can simply return that to the center position. Let's make sure that that's centered. There we go. And then the drill slides off, leaving the cannula in place in the body, and you can attach your syringe for aspiration or injection. To remove it, you simply put it back in, hit the reverse button, and back it out of the body. And this will automatically lock the collar in place when this is in forward or reverse in the body. So we've already anesthetized the skin, we've anesthetized the deep tissue, and I used an 18 gauge needle to create a little portal for the bit to get into place. Go down until I hit periosteum. I'm going to advance very slowly. Okay, once you are confirmed in position with your fluoroscopy and your angle and depth is accurate, now you can remove this. Remember, you hold on to this, you put this in the center détente position, and the whole thing slides right out, and you're ready to do the injection. So we've removed the center stylet. We're going to attach our high concentrate PRP. and then we slowly begin to inject. Okay, turn it